Thank you for joining us for the 49th Annual AAKP Patient Meeting. I hope that you all have enjoyed the sessions. My name is Chef Oliver Hale. I am a two-time kidney transplant recipient from Grand Rapids, Michigan. I am a retired healthy lifestyle chef, and also I am a retired host of a cooking show that I was able to host for 11 years called Chef O Place here in Michigan. I am also part of the Team USA Transplant Olympic team. I have been able to join and travel with other transplant recipients in competing in Olympic sports. Those sports have took me to 13 different transplant games nationally and also 9 different countries. So I have enjoyed my life as a transplant recipient. I have the honor today to serve as a new member of the AAKP Board of Directors, and also I am a AAKP Ambassador. Being an AAKP Ambassador have allowed me, encouraged me, and also provide me with the opportunity to widen my area much more to educate the public of kidney disease. Since I have been a AAKP ambassador, I have been able to travel around more than I was doing before, and also tell people more about being a kidney transplant recipient. I love doing the part about being an advocate of a transplant person. As a proud member of the AAKP, I firmly believe that every kidney patient voices are paramount in determining their care plan. It is essential that we cultivate an environment that encourages kidney disease research and also innovation, driving continually to advance in care and also improve treatment and the sources to fulfill patients' need. Once these innovations receive FDA approval, it is equally important that all patients have the access to and the right to choose the best treatment for them and consult with their healthcare team. This ensures every patient can live their best life and achieve their aspirations. At AAKP, we believe that empowering patients with knowledge and strategy to manage their health is a key to improving the outcome and quality of life. Nutrition and physical health are the fundamental pillars and journeys of managing kidney disease. With that in mind, it is my honor to introduce our next session, titled Disease Management, Nutrition, and Physical Health, Understanding the Balance for the Optimal Health. Today, we are honored to welcome a valued guest, a friend, and a distinguished guest, Dr. Greg Wisont, who is the renal dietitian for the Chronic Kidney Disease Program for the Northwest Kidney Center, the world's oldest dialysis organization, and it has been open since 1962. Dr. Wisont brings a wealth of experience in guiding patients through the complex of nutrition and physical health, specifically for those living with kidney disease. Dr. Wisont insights into achieving the delicate balance between the two aspects of helping patients with the tools they need to live a healthy and more fulfilling lives. Please join me in welcoming Dr. Greg Wisont.
Thank you, Chef O, for that wonderful introduction. And I want to also thank the American Association of Kidney Patients for inviting me to speak at this 49th annual meeting. So let's get started here. So the title of my talk is Nutrition and Physical Health, Understanding the Balance for Optimal Health. So what does understanding the balance mean? What we're going to talk about today is the balance what is balance, and then what things we can do with regard to nutrition and physical exercise to actually impact that balance. So we'll talk about diet specifically, then we will talk about activity. We'll talk a little bit about how do you look for help, because we're not all islands and we all need some help. And then finally, we'll summarize by what are the takeaways that I want you to walk home thinking about. First of all, balance. So what do we mean by balance? So the definition of balance is the components or elements of a particular thing are in balance, or they're in the correct proportion. So balance, when you balance nutrition and physical health, it's different for different people. So when we think about what is balance for myself or what is balance for you, it will be impacted differently depending on what you're going through at the particular time. So for people with kidney disease, what do you want to know? The things that affect how I impact that balance with nutrition and physical exercise are understanding the kidney disease progression. How does it progress? I want to consider what factors lead to the progression. And then I want to understand what factors actually promote health. Because these things are what I want to balance in order to stay as healthy as I can. So how is chronic kidney disease staged? So we've all heard I'm stage 1, I'm stage 2. What does that actually mean? So if you have a healthy kidney, then your kidney can filter blood at 90 milliliters per minute or faster. If you have stage 3, your kidney can filter blood at 30 to 59 milliliters per minute or faster. So you can see as the kidney disease progresses into higher and higher stages, your filtration rate, which is what we're talking about here, that you stage kidney disease with, your filtration rate gets lower and lower. So as kidney disease progresses, it means it takes the kidney much longer to filter the blood than what a healthy kidney does. So what we want to know in understanding how we're going to balance our nutrition and physical health is what makes kidney disease progress? What makes CKD, chronic kidney disease, progress? What is driving your kidney disease? Think about it yourself. What do you know about yourself that is actually causing kidney disease to get worse? If we're talking about staging kidney disease with a filtration rate, then what we want to know is what is filtering in the kidney? What part of the kidney actually does the filtering? So here is a picture of a kidney. And the glomerulus, or that part of the nephron, is the part of the kidney that actually filters blood out. You can see in this kidney structure then, the glomerulus is part of a nephron, and that's sort of the functional unit of the kidney. But the actual filtering is with the glomerulus. So when you stage kidney disease, they look at the filtration rate by calling it the GFR, or the glomerular filtration rate. And you have, in a healthy kidney, 500,000 to 1 million of those glomeruli per kidney. So when we talk about decreasing the filtration rate, what we're talking about actually is destroying glomeruli. So what is it that you're doing, or that your body is doing, that makes this destruction happen faster? Because we want to slow it down to just a creep so that our kidneys can stay healthy as long as possible. So again, the question, how does kidney disease progress? We've seen some common themes here, and the primary causes of kidney disease, chronic kidney disease, are high blood pressure, high blood glucose, polycystic kidney disease, or immune response, inflammation. Those are the primary drivers for kidney disease in the United States. So then I want to ask you, which one of those is driving your kidney disease? Because that's what you want to focus in on, because you want to make your balance unique to you. So when I think about the patients that I have, 75%, between 70 and 80% of my patients have either high blood pressure and or high blood glucose. So that is the thing for most of my patients that drives their kidney disease or drives the destruction of the glomeruli in your kidneys. So when you think about high blood pressure and it driving kidney disease, then you want to go, how is that actually happening? That may be a question you have. When you think of the glomerulus, it is a ball of small blood vessels, very small blood vessels. It's fragile. And when I think of it like a spider web. It's a fragile thing. And so when I think about high blood pressure, what is it that's making that web destroyed? And the pressure inside your glomerulus is actually what's pushing through that glomerulus and breaking it and causing it to be damaged. The same or similar things happen with high blood glucose. It's a different mechanism. For high glucose, it's not necessarily a pressure thing, but it is a oxidative thing. It's a fibrosis development thing. Those are the things that actually cause the damage to the glomerulus. So we want to find ways to keep our blood pressure low or our glucose low, and we'll talk about targets here in just a minute, in order so that we can keep our glomeruli more intact. And when you think about it here, so I told you there are between 500,000 and 1 million glomeruli in a healthy kidney. So let's just say your blood pressure goes above a certain level and you bust out a couple of your glomeruli. You're not going to see any impact. But if you bust out a few hundred or a few thousand over the course of months, years, and decades, you can see how that can greatly impact your filtration rate. So what is your blood pressure goal? So here is a chart that shows what the normal systolic and diastolic blood pressure. And the systolic and diastolic, that's only, it's just another word for saying your heart is contracting, is beating, or it's resting. Okay, so systolic is when it's beating, so the pressure is the highest. Diastolic is when it's relaxed. So if normal is 120 to 180, and when you're at risk, you're 120 to 139 in your systolic, most physicians will say that 140 is where you start to see damage to tissue. At 140, a systolic of 140. So we want to keep it down below 140, way below 140, because during our day, things happen that increase or decrease our blood pressure. For example, if you drink a cup of coffee, caffeine causes your blood pressure to go higher for most people. So if your blood pressure, when you take your blood pressure, is 135 and you drink a cup of coffee, it's going to pop over 140. So when you think about what is your goal, what do you want to keep your blood pressure at when you look at it, you want to keep it in the mid to low 120s over 80 so that you have room to have that cup of coffee and not go over 140. Similar questions can be asked about your blood glucose. What is your goal for blood glucose? When your doctor wants to measure what your average glucose is over a period of time, they look at this measure called an A1C. And an A1C is simply the number of glucose that are bound to hemoglobin. So when you have an A1C of 7, most people would agree that an A1C of 7 is when you start seeing tissue damage. So what's that equivalent to in day-to-day blood glucose? That is equal to a 150. Now, when you have kidney disease stage 1, the recommendations for KDIGO, which is Kidney Disease Improving Global Outcomes, they suggest that you shoot for an A1C of 6.5. So if you can work to keep your blood glucose below 150, then your average will be below 7. And you can make your glomeruli last longer. So how do you know that you're being successful? How do you know that you're keeping your kidney disease progression at bay? Number one, you're going to do daily monitoring, because you can't know if you're being successful unless you measure the primary things that are actually making kidney disease to get worse. So daily monitoring at a minimum. When you monitor blood pressure cuffs are the easiest way to monitor it. So when you think about getting your blood pressure, you want to take your blood pressure at the same time every day. Data is only as good as what you collect. So when you take your blood pressure, you want to take it in the same way at the same time of day. Hopefully you're relaxed. You have the same posture. Usually you're sitting down. You have good posture, and you take your blood pressure. Then you can start comparing it day to day to day and see how your trending is. The same thing happens with your blood glucose. So there are continuous glucose monitors, or CGM, and the CGM can actually get a measure of your glucose minute to minute. This is an excellent way for you to look at what foods impact your glucose the most. For example, you can eat something and you can watch your glucose go up and see how high it goes. You have a target now. You want to stay below 150. So think about when you eat, you can look and see how that impacts your glucose. And you can say, okay, I can tell what really is causing my kidney disease to get worse. And that's what you want to focus on. Okay, so what can we do to keep the blood pressure low or the glucose low? Diet is one way that we can impact blood pressure. And blood pressure really can be impacted via diet two ways, many ways, but two primary ways. Yeah, the first way is with day-to-day regulation. And day-to-day, you can impact your blood pressure with sodium. Long term, you can impact your blood pressure with the kinds of fats that you eat. So let's take a closer look at sodium. And I know everybody's heard a lot about sodium, but let me take a little time to look at sodium a little more closely. What does sodium do to blood pressure? And why is it so damaging? So sodium, what sodium does, it is primarily in the bloodstream. And so what sodium does is it holds water, and it holds water in a specific place. And so since sodium is in the blood vessels, what it's doing is it's holding the fluid of your blood in your blood vessels. So your fluid can go in three different compartments. It can go in your cells, it can go in between your cells, or it can be in your blood vessels. And sodium holds it in your blood vessels, which causes you to have increased blood pressure, and that's what is blowing out your glomeruli. So when you think about a sodium goal, then you want to have your sodium to be between 1,500 and 2,000 milligrams per day. That's equivalent to about a teaspoon of salt, or 5 grams of salt. So if you can keep your sodium below 2,000, and most people keep their sodium around 3,500 to 4,500. That is the US average of sodium intake. So what you want to do in order to keep your kidney disease from progressing, you want to keep your blood pressure low, and you can do that by keeping your sodium goal. Where is sodium coming from? Most of us understand that the amount of sodium that we add at the table with a salt shaker is only about 10% of the sodium in our day. Similarly, the amount of sodium that we add while we're cooking is only about 5 to 10%. So there you got only 15 to 20% of your sodium is coming from your table or from your cooking. Then the majority of sodium, it's actually coming from other places. And the primary place that sodium's coming from is from processed foods. And processed foods are all foods that are partially or wholly prepared before they come to you. All foods come to you with a nutrition facts label. unless they're whole foods, like, for example, meats. So cooked meats don't have a nutrition facts, but most other items do. So how do you know if something is high salt? So what you can do is you can look at a couple of numbers on your nutrition facts. And I know you guys have looked at this before, but I want to give you a kind of a pro tip here. So first of all, I would like you to look at the serving size. So knowing that your goal is between 1,500 and 2,000, if you divide that into 3 so that you have a meal size of sodium, it's going to be about 600. If you look at your serving size on your nutrition facts label, you ask yourself, do I usually eat just a serving size, or do I eat the whole container's worth? Because if the serving size is 1 cup and you eat the whole container, there's 2 servings in that container. That means we double the sodium that's on the nutrition facts label. And so instead of 470 milligrams, it would be twice that. So that's something to keep in mind. So the next thing I want you to look at is the sodium level. So the sodium content here, I want you to look at the milligrams. Some people think it's easier to look at percent daily values, but I think percent daily values are oftentimes confusing. And if you know your goal is 1,500 to 2,000, then knowing the actual amount of sodium makes it easier. So look at the sodium, and we're going to compare that with the calories. So if the sodium is below the calories, then we're good. If the sodium goes above the calories, then it is what I would consider a high salt food. Now, why does that work? It works because most of us take in about 2,000 calories a day, plus or minus a couple of hundred. So if you always keep the sodium below the calories on the things that you buy in the grocery store, then you are always going to eat less than 2,000 milligrams per day. Does that make sense? Let's just say, for example, you have something that you really like, but it is a high salt food by this definition. For example, what things are high in salt? Bread, cooked meats, cheeses. So let's say you have a piece of bread and you want to eat your toast with your egg in the morning. How can you eat that toast in a healthy way? Because you know that's a high salt food. So we're going to use that calorie to sodium ratio to our advantage then, because we'll pair that bread and eat at the same time something that is high calorie, low salt. For example, we could put an avocado or a couple of slices of avocado. Avocado is high fat, really good fat, and low salt. So if we eat our toast and a couple of slices of avocado, now we still have our calories above our sodium for our whole meal. Does that make sense? So what about blood glucose? How can we deal with blood glucose? Blood glucose has a lot to do with how we're monitoring it. And if you have chronic kidney disease, most insurances will pay for a continuous glucose monitor, at least for short term. If you look at your glucose monitor when or after you eat, again, most of the time it's between an hour and 2 hours after you see your max. And so let's say, for example, you ate a cookie and you eat your cookie and your blood glucose goes up to 200. You're saying, okay, I know that's too high. I know that's damaging my kidney. I want to keep it down. What am I going to do? So first you can do is portion control. You can eat half of a cookie. So you still get the taste of that cookie, but you eat half of a cookie. So what will that do for you? You eat half of a cookie. Now you look at your glucose. It's only at 160. So you've decreased your blood glucose substantially, but it's still a little bit above your target. So what else can you do? You can eat that cookie with something else that slows down the absorption of the glucose to keep it lower for longer. What are things that you can pair with it? You can pair fat with it or protein with it, and that helps keep the glucose down so you can still have your cookie healthy-like. Okay, so what are other things? So the 2 primary things that are driving kidney disease, the blood pressure and the blood glucose, we have a sense for. Now, one of the things that I want to say is there are other things that you can do to keep you healthy that may not be driving blood or may not be driving the progression of kidney disease, but you need to address them to keep yourself healthy. For example, protein, potassium, and phosphorus, or the three Ps. So protein, why is there concern about protein? Well, when you think about one of the primary jobs of the kidney is to remove blood waste, the biggest contributor to blood waste is protein. So if your kidney filtration rate is so much slower than a healthy kidney, then we need to be careful about the amount of protein we have so that we don't overwhelm the kidney with waste. There is some suggestion that your protein may also push kidney progression a little bit. I think that we need to balance that though against increased muscle loss with lower protein intakes as we age. So in general, you want to think about 0.8 to 0.7 grams of protein for every kilogram of body weight. That is a general recommendation. So potassium. Potassium, my patients, potassium is top of mind. Potassium does not cause kidney disease to get worse. Now, that doesn't mean we ignore it, because high potassium or too low a potassium affects how your electrical conduction system works in your body. So what works with electrical conduction are nerves and muscles. So it's really important that those work well. For example, your heart is a muscle. We want our heart to beat on a regular basis. And so we want to be careful about potassium for that reason, but not for the reason that it causes an increase in kidney disease progression. What do I want you to do with potassium? The first thing my patients always tell me is, my doctor told me, or my nurse told me, or my friend told me, or Dr. Google told me that I need to never eat avocados. I say, eat avocados. I want you to keep whole food potassium as much as you can. And yes, I want you to eat those nuts. I want you to eat those beans. I want you to eat those avocados and bananas, okay? Those and tomatoes. One of the reasons I picked the first title slide was because it has tomatoes on it. Tomatoes have lutein, zeaxanthin, carotenoids, amazing nutrition that keeps your body healthy. So it comes along with a high potassium, yes, but you want those other nutrients. So keep whole food sources of potassium. What I want you to eliminate, if you need to eliminate potassium, and oftentimes you don't, but high blood pressure medicine sometimes helps or causes your body to hold on to potassium. And in those cases, you need to watch your potassium intake. But what I want you to do first is eliminate sources of potassium that are in processed foods, because sources of potassium that are in processed foods are much more quickly absorbed. Sources of potassium in whole foods are much more slowly absorbed, and they usually come with fiber, which helps to move your bowel through. And when you have constipation, one of the issues with my dialysis patients, when you have constipation, your body tends to absorb more of the potassium. So the fiber, along with those whole food sources of potassium, are really important in keeping your potassium low. Phosphorus. So phosphorus, again, does not directly lead to kidney disease progression, although there is some evidence to suggest it causes a hardening of blood vessels, which definitely contribute to high blood pressure. But it is really from the bone, and the kidney's involvement in bone health is really important here, because as the kidneys is more and more damaged, it becomes less able to help the bone stay healthy. So if phosphorus is too high, then what it's going to do is it's going to go around your body and make soft tissue hard. You do not want your soft tissue hard, because it doesn't work as well. For example, your blood vessels, because that will lead to high blood pressure. So you do need to keep phosphorus in control. But again, that's not necessarily driving kidney disease progression. activity. This is another way that you can help control high blood pressure and high glucose. Now, the American Heart Association says activity at 30 minutes per day, 5 days a week at least, and moderate intensity. And you can tell that you're moderate intensity by the fact that you can't hold a note. So if you can sing, then you're not going at moderate intensity. That's what the American Heart Association. And if you can do that, that's great. But many of my patients can't do that. So then I tell them, move your body more than you normally would in a day. That is your exercise. What are you doing with that? When you move your body, you're getting blood flow into your muscles. Your muscles are one of the primary tissues that keeps blood glucose low. When your body has insulin or you get insulin injection, the primary tissue that listens to the insulin to take glucose out of the blood is the muscle. The liver is also instrumental, but there's so much more muscle out there. And that's why you want to maintain your muscle. Because kidney disease tends to want to melt muscle because of a lot of different things about it, then you want to do everything you can to maintain your muscle tissue. And activity helps you maintain it. That helps you control your blood glucose. It also helps you control your blood pressure over long term. You can decrease blood pressure over time by engaging muscle tissue, and you can improve glucose control by helping your body maintain muscle mass. The only way you're going to maintain muscle mass is if you tell your body very firmly, I need to keep that muscle. And the only way to do that is by using it. So if you don't use your muscle, then your body's going to take it away. So please be as active as you can. Best ways to be active are to find friends or other people to help you be active. If you find it fun, if you enjoy it, if you look forward to it, that's what you want to do. Because there are a lot of times where it's hard to get started, and getting started means you need other people sometimes to help encourage you. So when you're looking for dietary help, you want to go and find a dietitian. A dietitian, a registered dietitian, has gone through specific training to help you find ways to fit your lifestyle into the healthiest space you can with food. If somebody tells you, don't eat that, leave. Because you should be able to eat anything. You just want to eat it in correct proportions or in the correct frequency in order to help yourself eat it in a healthy way. So the general advice can be given to groups of people. But if you want specific advice, and this is what I encourage you to do, if you want specific advice to you, get a prescription for medical nutrition therapy. It's prescribed by a physician. It clearly improves patient outcomes. There's a lot of data out there, and it's evidence-based. So when you get medical nutrition therapy, you get therapy that helps you specifically keep the things that make your kidney disease get worse under control. That's what you want. So when you have heart problems, you go to a cardiologist. If you have diet issues, you want to go to a registered dietitian. So what are the takeaways here? Remember, balance means being aware. Being aware of the things that cause kidney disease to progress. Monitor them. Keep track of them. Know how you're doing. Because once your kidney is damaged, it's not very likely that it's going to get healthy again. So when you find health practice, focus on the ones that cause kidney disease progress and keep those under control. That's the best way to slow down the progression of kidney disease. Get help with MNT, medical nutrition therapy, from a registered dietitian. Remember, you're in control of your health. If your nurse or your doctor or your friends or Google says, hey, you're doing fine, you're only stage 3, you don't need to worry about anything else, don't listen to them. You're in control. You take control. The earlier you take control with activity and diet, the longer and first of all, the longer that you can extend your kidney health before dialysis is better. And also, it helps you be aware of healthy habits. Remember, take control now. Okay, I want to thank again the American Association of Kidney Patients for inviting me to speak. Really enjoyed it. I'll take questions now.
Thank you, Dr. Wisoff, for that excellent presentation. I have a few questions I'd like to ask you. Okay. First one here, Dr. Wisoff. What are some common misconceptions about diet and exercise for kidney patients that you have encountered?
Some of the most frequent misconceptions that I encounter about diet and exercise and kidney disease is that it's not important until kidney disease gets really bad. So I have many patients come to me in late stage 4, so they're right before they start dialysis, and they want to try and change their diet, and they want to start becoming more active. And yes, that will help a little bit. But if you start those changes early, like in stage 3, you can do so much more benefit to holding the health of your kidney.
Okay, second question I'd like to ask you. How do you address the challenges that some kidney patients face, such as food insecurity and limited access to fresh foods, while trying to maintain a kidney-friendly diet?
That is one of the most difficult things because kidney disease is actually a social economic disease. Oftentimes, I find that food insecurity is highly correlated to the progression of kidney disease. Fruits and vegetables are not the cheapest thing to buy. Fresh food, healthy food is not the cheapest thing to buy. And so, what I encourage my food insecure patients to do is to get assistance. There are government assistance. You have SNAP benefits. In Washington State, we have what's called a fruit and veggie program. And so that allows people who qualify for SNAP benefits to also qualify for free or reduced fruits and vegetables. So I encourage food insecure to seek aid. And to focus also, it almost becomes more important with food insecurity. It almost becomes more important to focus as much as you can on farmers markets or alternative sources of buying your fruits and vegetables.
There's something else I learned, Dr. Wizot. One more question I have to ask you. How do you recommend patients strikes the right balance between maintaining proper nutrition and engaging in physical activity, especially when their energy level may fluctuate due to the chronic kidney disease?
That's a great question. That is such a great question because a lot of my patients are are a little incapacitated. I mean, they have struggle walking sometimes. They have struggle sometimes because cardiovascular disease is really closely associated with kidney disease. It's really challenging for those patients to be active because walking, just getting up out of a chair, makes them out of breath. And so sometimes standing at a counter and cutting up food or preparing food is too much for them to do. So how do you do that? I encourage you to do what you can, understanding that that is what you can do, and give yourself credit for the things that you can do, because we all can make small changes, and when that's what we can do, then that's what we can do. You want to focus your energy and effort on the things that really make a difference. And those are the things that push kidney disease to get worse. So when we're talking about blood pressure, you want to focus on your salt intake. That's an immediate impact on blood pressure. And when we're talking about glucose, we want to keep your glucose low. So focus on the things that you can do. With activity, you just Move your body as much as you can, or more than you normally would in a day. Everybody can do a little bit, even if it's as much as when you sit down at the table to eat, you stand up and sit down and stand up and sit down. Maybe that's the only amount of activity you can do. That's good enough. So I encourage patients to do what they can do and be happy with that.
Dr. Weiser, again, we want to extend our heartfelt thank you for your incredible presentation. I know you share insight and experience have truly resent with our audience. We are grateful for the time and effort you put in joining us and deliver such a valuable presentation.